related to intrinsic, right? So if you activate 12, 12 will activate 11, 11 will activate 9, and 9 will activate 10. And then extrinsic is just 7. 7 activates 10. Okay? So the common denominator in both of those, the common cofactors for both of those are the 10, and everything below the 10. Thrombin, fibrinogen, that stuff, okay? In terms of, so this is pretty much the same concept, but if you just know this, then you should be able to define the coagulation factors. So warfarin is associated with intrinsic or extrinsic? Extrinsic, right? So warfarin involves vitamin K deficient or vitamin K dependent cofactors. Extrinsic. So warfarin is associated with vitamin K dependent cofactors, and that includes 7, 2, and 10. So heparin is intrinsic, right? Because heparin activates antithrombin, antithrombin 3. Antithrombin inactivates thrombin. So in effect, heparin inactivates thrombin, right? And thrombin is involved in the activation of 13, 11, and 10. And notice that 11 is on our intrinsic pathway, right? TEN is the E off of TEN. So that's why heparin affects the intrinsic pathway. Does anyone have questions with all that? Okay. So that was the end of blood. Moving on to the cardiac.
Is in middle.
I didn't hear that either. Because then she confused me because I like have these associated.
Okay, let me open for a minute.
Okay, guys. What is this? Coronary artery. So what's this?
Right.
Right.
Atrium.
Ventricle.
Right ventricle.
Ventricle.
So what's this? Left ventricle. So this is right ventricle. What's this? Pulmonary artery. What's behind the pulmonary artery?
Aorta.
Aorta. Okay, so same thing. Coronary arteries, right ventricle, left ventricle. What's this? Left atrium. What's this? Right atrium. What's this?
Pulmonary.
Pulmonary artery,
Aorta.
aorta,
Vena cava. Superior vena cava.
superior vena cava,
Inferior vena cava.
inferior vena cava. So theoretically, I could say, I could have arrows pointing to different trunks or chambers and say, which of these, which of these does deoxygenate the blood enter from the body, enter the heart from the body? Or, so that would be what?
Right atrium.
So it would be superior vena cava,
Oh.
inferior vena cava, right? Or which of these does oxygenated blood enter the heart from the lungs or something? Then you point to whatever the arrow is leading to the, pointing to the, which one?
Can you repeat the question?
So it's oxygenated blood that goes into the heart from the lung.
Pulmonary vein.
Yeah, pulmonary vein. So if there's, not in this one, but if you have a heart that has a pulmonary vein with an arrow on it, you point to that one, right? So it would be identification of the artery or the vein, and also what it functions to do. So this here, what is this? Right atrium. Right ventricle. What's this string thing? Chordae tendineae. What's this? Papillary muscles. And then if I push the wall here, the papillary carne, okay? Okay, and then this is pulmonary valve, okay? And then this here,
Left ventricle.
left ventricle,
Left atrium.
left atrium. So same concept here. We'll just move on here. Okay, so what's number 8? Papillary muscles. What's this white stuff? Chordae tendineae. What's this number 6? Right atrium. What is number 5?
Mitral valve.
Mitral valve or bicuspid valve. Okay. And then what's number 2?
Pulmonary.
Pulmonary artery. What's number 3?
Septum.
Septum. Interventricular septum. Okay. So I want you to be able to identify valves and chambers when we're looking down from the top, right? Down at the heart from the top. What's anterior, what's posterior, right? So remember that anteriorly you're looking at the pulmonary valve, right? Then posterior to that is the aortic valve, and then posterior to that you've got the left and right heart. So which one is this one? So that's the right, right? Right cuspid. And then this is the left, right? Right cuspid. So sometimes looking down, you're used to seeing, normally we're used to seeing the heart like this, straight up, and then the left side is actually the right side, and the right side is actually the left side. When you're looking at from the top down, it's the same as the side that you normally look at, right? So right is right, left is left. Does that make sense, or did I confuse you? Okay. So we're looking at the right atrium here. What are these? What valve is this? Tricuspid valve. What is this? Papillary muscles. What are these? Chordae tendineae. What are these? The wall? Tuberculate carne. So this is just the flow of blood through the heart and to the rest of the body. So this is just differentiating between the artery and the vein. What are the differences?
Valve.
Valves and also muscle thickness, right? So the arteries tend to have thicker muscle layers, and valves tend to have, veins tend to have valves. And remember, so what is this?
Venule.
Vein and artery. So arterioles and venules, right? So which one has a thicker, smooth muscle layer? 1 or 3?
One.
1. Okay, so same thing we were talking about, right? Valve, vein, thick muscle layer, artery. So if you, for some reason, have incompetent valves, what do you end up with? Varicose veins, right? Blood kind of can't go up the leg, so it kind of pools down below. You have swelling and varicose veins. So this is just being able to follow the movement of blood through the heart. We'll skip through this. So next thing to talk about is the cardiac pressure. Okay? So here's your right atrium, right ventricle, left atrium, left ventricle. So what valve is this?
Tricuspid.
Tricuspid valve. So if RA is greater than RV, pressure in RA is greater than RV, is this valve open or closed? Open. If the RV is greater than RA, is this valve open or closed?
Close.
Closed. What about this valve? What valve is this?
Pulmonary.
Pulmonic, right? Pulmonic valve. So pulmonic semilunar valve. If RV is greater than PA, pulmonary artery, RV is greater than PA, what happens to this valve? Open or closed?
Open.
Open. If RV is less than PA,
Close.
closed. Okay. So just to make sure we understand, it sounds like you guys have it down right here. So what valve is this?
Mitral.
Mitral. If LV is less than LA, what happens?
Close. Oh, opens.
Opens, right? LV
She
is less
switched it
than
up on me.
LA, it opens. If AO is less than LV, right, the aortic valve opens, right? And if AO is greater than LV, the aortic valve closes. Is that clear, guys?
Yes.
If you have trouble, raise your hand, let me know so we can continue. Okay. So mean arterial pressure. What's the formula for mean arterial pressure? Okay, so mean arterial pressure, cardiac output times systemic resistance, right? So that's mean arterial. We have like 3 different equations. Let's start with that one. What is the formula for cardiac output?
Heart rate.
Heart rate times
Stroke volume.
Right. So heart rate times stroke volume is cardiac output. Cardiac output times systemic resistance is MAP. Right. So that therefore heart rate times stroke volume times systemic resistance is MAP. So if you didn't have those numbers and we're just talking about systolic pressure and diastolic pressure, at rest, what is MAP? 2/3, which one? Yep, 2/3 diastolic plus 1/3 systolic pressure, right? And why is that? Why is diastolic pressure got a bigger fraction?
Because you rest more than you.
Right. So when you're contracting, normally it sounds like this: lift up, lift up, and between the love and the dub, that's your contraction. So the time between lift up is shorter than the time between dub and love when you are filling, right? Lift up, that's the contraction. Lift up, and then filling is dub, back to love. So you spend more time in diastole when the ventricles are filling than you do when they're contracted. So when you're exercising, your heart rate increases, right? So the amount of time you spend in contraction actually increases. So therefore, what is your MAP formula for a person in exercise? Half, right? So 1/2 systolic plus 1/2 diastolic. And then in terms of pacing, you start at the SA node, and then it leads to the AV node, and that goes to the bundle of His, and then down both branches of the bundle, and then over to the Purkinje fibers. What is the normal firing rate for sinus nerve? Normal firing rate for sinus nerve? 60 to 100. Normal firing rate for AV node? 40 to 60. And then the Purkinje fibers are lower than that, right? So EKG, all I need to know is be able to recognize the waves, right? So here's P wave, Q, R, S wave, T wave. So from here to here,